Angelicus Spurbs.
Welcome to Spurbs Herbs, episode 87. Today we're going to be talking about Shi Gao. Gypsum fibrosum is the Latin name for it, and the common name is just gypsum. So today we're going to be looking at another single Chinese herb. All that stuff I just said, Shi Gao, gypsum fibrosum, or just gypsum. This herb is in the Chinese medical subcategory of herbs that drain fire and is among the coldest herbs in the pharmacopeia. It's useful both internally to cool various heat conditions as well as topically in many dermatological conditions. As usual, we will explore all the intricacies of this herb as well as an explanation of its category. And as always, we will look at something a little different. We're going to discuss some basic pharmacology today. Please stay tuned for this intriguing episode. And before we get into that, I'd just like to remind you, I've been teaching for quite a while now on a wide variety of topics. If you like this podcast and want to explore more of my courses, they are available at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org, and include a ton of different topics, including my drug herb series, looking at drugs and how they interact with herbs and vice versa, several ethics and safety courses, Chinese medical research, several treatment of condition courses such as arthritis, neck and back pain, COVID, and depression and anxiety, and one of my favorite courses of all time, the Chinese Herbal First Aid Kit. And they are all at a reasonable cost, and you can get an additional 20% off with the code SH20OFF. That's SH as in Spurbs Herbs, 20 OFF. Today, for something a little different, we're going to discuss some basic pharmacology. While that may seem on the surface to not be relevant to herbs, I would posit understanding basic pharmacology helps our understanding about how herbs work. This is because the basic principles of pharmacology describe how herbs work on the body just as much as the pharmaceutical drugs. The big difference between the two lies in the concepts of whole foods versus refined substances, as we discussed way back in episode 53. That is a great discussion of whole foods versus refined substances. You should check out episode 53 if you're interested in that discussion. So pharmacology basics. First, we can kind of break down pharmacology basics into two major concepts. One is pharmacokinetics. And pharmacokinetics describes the action of drugs within the body, includes the absorption, distribution, metabolism, and elimination of drugs, in addition to the rate or kinetics at which a drug's actions begin and their duration. So I like to think of pharmacokinetics and how drugs move through the body and how fast they do so. The other basic schism in pharmacology basics is pharmacodynamics. And this looks at how drugs act in the body and deals with mechanisms of action in addition to the actions of different drug concentrations or doses. So I think of pharmacokinetics as how drugs move through the body, and we'll explain more of that in just a minute. And pharmacodynamics is how the drugs act on the body. So that's how I like to think of the two. So when we talk about pharmacokinetics, there are four major areas that we look at. It's called the ADME scheme, ADME scheme, ADME scheme. And includes absorption, distribution, metabolism, and elimination. Absorption is primarily in the intestines and describes how a drug gets from the site of administration to the bloodstream. If you're injecting a drug into a blood vessel, then there is no absorption. 100% of it is absorbed immediately. Generally, we talk a lot about absorption when we talk about oral drugs. So that's the first one, absorption. Distribution is in the blood. Once in the blood describes how the drug gets to the site of action, either the interstitium or tissue cells. So basically it describes how it gets distributed around the body. Then we have metabolism, which primarily happens in the liver. And this is biotransformation of the drug, usually to an active drug or to prepare for elimination. Most usually to prepare for elimination. And finally, E in ADME is elimination, which happens usually mostly in the kidneys, though it can happen in a lot of other areas. And this is removal of the drug from the body, more often than not in urine, but there can be other routes, including the stool. So let's get into these a little bit more depth. So absorption, the rate and extent that the drug leaves the site of administration. For example, how long does it take for an oral drug to enter the bloodstream from the small intestine, and how much of the drug makes it there? That how much of the drug makes it there is bioavailability. We've talked about bioavailability in a previous course, in previous SPURBs, we're not going to do it here. Administration routes of drugs play a large role in drug absorption. Three major categories of administration are enteral, parenteral, and other. Enteral means through the gastrointestinal tract, basically taken orally, though, yeah, that's basically what it means. Parenteral means outside the gastrointestinal tract. It refers to introducing drugs directly to the systemic circulation, basically by injection. And then we have that other category. I like to put, like, there are suppositories and things like that that are rectally administered. I like to put that in the enteral category, though most people put that in the other category. Other can also mean topically, you know, through the skin. There's a few other things that can happen there as well. So let's talk about enteral administration. Absorption from the gastrointestinal tract is affected by multiple factors, including surface area, blood flow at the absorption site, drug state, solution, solid suspension, water solubility, and concentration. How much of it is, how concentrated is it? Oral drugs can be absorbed in the stomach or through the duodenum in the intestine, which is the most common site of absorption due to its vast surface area. Parenteral administration. Parenteral injections of drugs include intravenous or IV injection, is where an aqueous solution is injected into a vein. There's dermal injection, is into the dermis of the skin, is generally the most superficial of the approaches. There's subcutaneous, which is also subcut or sub-Q for short. Injection is an injection below the dermis and in the subcutaneous tissues of the skin. There's intramuscular or IM injection into the muscle. There's intra-arterial injection, is relatively a rare administration into an artery. We generally don't want to do injections into arteries because they tend to bleed, but it does happen. And then we have an intrathecal injection, is an injection into the cerebral spinal fluid of the spinal subarachnoid space. This is usually done with someone bent over, and it's done at the base of the spine and usually below the third lumbar, because then you don't have any of the, you may have some nerves going, but you don't have the spinal cord going that low. So that's a quick introduction to parenteral administration. Let's talk about distribution. Go on to the D of ADME. Distribution is the process through which the drug reversibly leaves the bloodstream and enters the interstitium or tissue cells. There are four main factors that affect distribution: cardiac output and blood flow, capillary permeability, so this is how leaky the capillaries are, drug structure. Generally, we want drugs to be more lipophilic, which means they're fat-loving, rather than hydrophilic, which is water-loving. Tissue volume, in other words, how big is the tissue, and the degree of binding to proteins. And that's what we're going to spend just a minute talking about, is protein binding, because it plays such a big role in a lot of what we talk about with drug-herb interactions and things along those lines. So we'll talk a little bit about protein binding right now. So most drugs reversibly bind to plasma and tissue proteins, plasma meaning blood proteins. This slows overall distribution of the drug from the plasma and creates a reservoir of the drug. The most common protein for drug binding is also the most common protein in the blood, albumin. This binding is concentration dependent, meaning as plasma concentration of the drug increases, more binding occurs. This causes the free drug concentration to be maintained as a constant fraction of the total drug in the plasma. This can also occur when drugs bind to tissue proteins, creating tissue reservoir of the drug. That becomes important because when drugs are highly protein bound, that can start to affect other highly protein bound drugs or herbs, and can get into some drug-herb interaction stuff. So we are particularly worried about protein binding. The definition of highly protein bound is it's over 95% bound at any given time. So that's huge. The vast majority of it is in reservoirs, not active with that highly protein bound drugs. All right, let's talk about metabolism. That's the M of ADME. Drug metabolism refers to the biotransformation of a drug into another chemical. Usually this occurs in order to facilitate elimination, as most drugs are hydrophobic, and hydrophobic chemicals are more difficult to excrete. Some drugs need to be metabolized from an inactive form called a prodrug into an active form. The kidney is the main organ of drug elimination. If a drug is too hydrophobic, it will simply enter the nephron of the kidney and not stay within the tubule to be eliminated, so it doesn't get eliminated. To facilitate elimination, a drug needs to be sufficiently hydrophilic, in other words, water-loving. Metabolizing the drug accomplishes this feat. That's why it's important. And finally, in the ADME scheme, we have elimination. And elimination is the removal of a drug from the body. There are several methods by which a drug can be eliminated from the body, including excretion in the bile, into the intestines, through the lung. You can off-gas some drugs, or even in the milk of lactating mothers. We don't mention it can also be in the perspiration, sweat. Excretion by the kidneys, however, is by far the most common route of elimination of drugs in the body. Most drugs are like 80 to 90% eliminated through the kidneys. And then kinetics under pharmacokinetics. Kinetics are about the rates or speeds of reactions. In pharmacology, kinetics are involved with everything from the speed of absorption, distribution, metabolism, and elimination, all those things we just discussed, to steady state calculations and fixed dose, fixed time regimens, which I get into when I talk about this stuff in more depth, but we're not going to get into today. Let's briefly talk about pharmacodynamics, and then we'll get into today's herb. So pharmacodynamics describe how drugs act on the body. This includes drug receptors, the different types of actions that a drug can initiate, and the therapeutic index. Again, we're not going to go too much into this, but I do want to talk about the therapeutic index. Again, super important when we talk about drug-drug interactions. It's just super important when we're talking about the safety of drugs. So let's talk about it. So the therapeutic index, also called the therapeutic margin or therapeutic window, is a measurement of how safe a drug is. It is a ratio between the toxic dose and the therapeutic dose. It's a little more complicated than that, but that's basically what it is. Since it is a ratio, the larger the number, the safer the drug is. Agents with a small therapeutic index generally need to be well monitored in order to avoid detrimental effects. And that was a short introduction. That's it. That's a short introduction in the basics of pharmacology. If you want to get more in depth on this topic, check out my first course in my drug herb series, The Basics of Pharmacology and Chinese Medicine, available at www.integrativemedicinecouncil.org, COUNCIL council.org. Okay, so that was the basics of pharmacology in just 10, 12 minutes, 15 minutes. All right, so let's get into today's herb, Shi Gao or Gypsum fibrosum. This is a mineral, so it has a mineralogical classification rather than a family, a plant family. And its classification is a sulfate mineral. We'll talk about what that means in just a second. Standard object is called crystalline gypsum. So that's sort of the equivalent of the true species name here. And the English translation of Shi Gao means stone paste, which is interesting because as we're going to find out, it's used often. It's what makes up plaster of Paris. So it's almost like stone paste, I guess. Other names other than Shi Gao include Baihu, Da Shi Gao, Shili Shi, Xianwei Shi Gao, Yu Huo, Yuan Shi Gao, Shi, Seko, that's in Japanese, and Syoko in Korean. Again, I don't know how to pronounce Japanese or Korean, so I'm just winging it. Bensky, so we have three main texts here when we talk about single herbs. Bensky and his team is one of those. That's the Chinese Herbal Medicine Materia Medica, 3rd edition. Say the dosage is 15 to 60 grams. So that's a lot larger than most of our herbs. Most of our herbs are anywhere from 3 to 15 grams. So this starts at 15 grams. It goes up to 60 grams. Chen and Chen, our other major textbook here, say 15 to 60 grams. So same, with a maximum of 100 grams. And Brown and Wiseman also say the dose is 15 to 60 grams. So usually we don't get such homogeneity between our three textbooks here. But they all agree 15 to 60 grams is the dosing. Chen adds you can do a maximum of up to 100 grams of this herb, which is a lot. Let's talk about sulfate minerals for just a second here. Sulfate minerals are naturally occurring salts of sulfuric acid. About 200 different kinds of sulfates exist in literature, but most of them are rare and locally occurring. All sulfates possess an atomic structure based on discrete insular sulfate SO4 2- tetrahedra, so i.e. ions in which 4 oxygen atoms are symmetrically distributed at the corners of a tetrahedron with the sulfur atom in the center. These tetrahedral groups do not polymerize. In other words, they don't connect together. And the sulfate group behaves as a single negatively charged molecule or complex. Thus, sulfates are distinct from the silicates and the borates, which link together in chains, rings, sheets, or frameworks. Abundant deposits of sulfate minerals such as barite and celestite are exploited for the preparation of metal salts. Many beds of sulfate minerals are mined for fertilizer and salt preparations, and beds of pure gypsum are mined for the preparation of plaster of Paris. That's a brief introduction into sulfate minerals. Let's go back to our herb, Shi Gao. So the category, Bensky and his team put this herb in the herbs that drain fire subcategory under the herbs that clear heat category. Chen say it is in the heat clearing and fire purging herbs subcategory under the heat clearing herbs category. And Brown and Wiseman say it is a heat clearing fire draining medicinal under the heat clearing medicinals category. All three of our sources say it is sweet, acrid, and very cold, and enters the lung and stomach channel. So I always like to take a little bit of a pause when all three of our books agree, because they don't often. More often than not, they do not agree. And so the fact that all three of our books are agreeing that this has the same properties is a pretty significant agreement. History. This herb, both Bensky and Chen, which again, they don't always agree on this, say the original source for this herb is the Shengnan Ben Sao Jing, or Divine Husbandman's Classic of the Materia Medica in the 2nd century CE. This is the first existing book on on single herbs. So basically, there are no earlier texts that we have existing that talk about herbs from China. I don't want to say none, but this is the most complete, most put together. This is the first, considered the first that we have. According to Bensky and his team, they have a nice little discussion of of the category herbs that clear heat. So let's talk about that, and then we'll get into the subcategory. So heat in traditional Chinese medicine refers not only to febrile disorders or problems attributable to the invasion of pathogenic heat, but also to any condition that presents with heat signs: dry throat, red face, red eyes, dry stools, and dark and scanty urine, yellow tongue coating, rapid pulse, and a sensation of warmth in the 5 centers: soles of the feet, palms of the hand, and sternum. Those are the 5 centers. Heat can be found in either the exterior or the interior. Exterior heat presents with fever, chills, headache, thirst, moderate sweating, and a floating, rapid pulse. Interior heat presents with fever without chills, dry mouth, thirst, irritability, scanty and dark urine, yellow tongue coating, constipation or diarrhea, and abdominal distension. The herbs prescribed in this category are used for treating interior heat. In general, these herbs are cold in nature. So that was the category herbs that clear heat. Bensky and his team continue to discuss the subcategory of herbs that drain fire. Herbs that drain fire are among the coldest in the Materia Medica. They are used for treating high fever, irritability, thirst, and delirium associated with febrile disease. In the 4-level Sifen system of differentiation, these symptoms generally correspond to the Qi level, and in the 6th stage or Liu Jing system to the yang brightness stage. Included in this group are herbs used for treating eye problems due to wind heat, as well as heat in the liver, lungs, or stomach. So that's their explanation of what's going on with the categories. Let's talk about good quality gypsum. So Bensky and his team say good quality consists of big, white, and pure pieces with fibrous structure and without any foreign mineral content. We have a great book called The Chinese Medicinal Identification, an illustrated approach. This is a great book that kind of explains what the herbs should look like and what good quality should look like. So love this book, use it a lot, and it's by Zhao and Chen. So they say Shi Gao has long lump shape, board-shaped or irregular pieces, externally white, grayish white, or pale yellow, sometimes translucent. It has a heavy, loose texture and is easy to break longitudinally. It is odorless and has a bland taste. Superior quality consists of large pieces that are white, translucent, fibrous on the longitudinal surface, and lustrous, as well as lacking in impurities. So what does it do? Chinese medical actions. According to Bensky, Shi Gao clears heat and drains fire for high fever without chills, irritability, intense thirst, profuse sweating, a flooding big pulse, and red tongue with yellow coating. This condition is one of excess in the qi level of the 4 levels of disease, or the yang brightness channel stage of the 6 stages of disease. With yang brightness, we talk about the 4 bigs, and that's what's here. It has big thirst, big sweat, big pulse, and I think a big fever. I think that's the 4th one. So bigs, the 4 bigs. Clears heat from excess from the lungs, for cough and wheezing with fever and thick, viscous sputum. Clears blazing stomach fire for headache, toothache, or swollen and painful gums due to stomach fire. For eczema, burns, and ulcerated sores, usually applied topically in powdered form after being calcined and mixed with other herbs. May also be taken internally for these conditions. Chen say it clears heat, sedates fire, relieves irritability, and quenches thirst. It clears lung heat, it clears heat in the stomach and stomach channel, and finally it clears heat and promotes healing of sores, burns, and eczema. Brandon Wiseman say it clears heat and drains fire, eliminates vexation and allays thirst, and absorbs dampness, closes sores, and engenders flesh. Continuing with Chinese medical actions, now we get some of our other books involved. Those are our 3 main textbooks, of course, but we have other books that we can look at as well. So Chinese medicinal identification and illustrated approach, that's what it talked about usually, about the quality of the herbs and what they look like, but it also has some medical actions. And they say it clears heat, drains fire, eliminates vexation, and relieves thirst. There's that word vexation again, which is interesting, but not surprising because Eric Brand and Brandon Wiseman, who wrote that textbook, Eric Brand was an editor on this book, so some of the language can be very similar between the two. The Divine Farmer's Materia Medica, which is the oldest existing book. We told you this on single herbs. That's the Shenang Ben Cao Jing we mentioned earlier. Puts this herb in the inferior class of jades and stones, which means it should only be used for short periods of time and for specific reasons. So in the inferior class of jades and stones, saying it mainly treats windstroke, cold and heat, counterflow qi below the heart, fright, panting, dry mouth, parched tongue, inability to catch one's breath, and hardness and pain in the abdomen. It eliminates evil ghosts and promotes lactation and heals incised wounds. So one of the things about this book in particular is it does kind of take sometimes a more magical approach to Chinese medicine, and that's where that evil ghost kind of comes in. The other thing that's interesting here is it says it treats windstroke, cold, and heat. Now remember, we said this is a very cold substance, and it's actually saying it can be used for a cold condition. Very interesting, very strange, and we're going to see why that might be the case. It's really fascinating. This is I always, I know my herbs, but I I always learn something when I put together one of these superb herbs. This is what I learned here was keep that cold in mind. We're going to talk about that. That was fascinating to me. So keep it in mind as we go along. Preparations. Both Chen and Brown Wiseman say this herb should be crushed and decocted before adding other herbs. Chen says 20 to 30 minutes of pre-decoction. So you crush it and decoct it, boil it for 20 to 30 minutes before you add any of the other herbs for the decoction. Both of these also agree with Bensky et al.'s use of unprepared internally and calcined externally. So we're going to talk about calcine in just a little bit. In fact, right now, Bensky and his team has a discussion of two special preparations. The first is unprepared gypsum or sheng Shi Gao. Sheng means fresh or unprepared. This is the form most commonly prescribed for internal consumption. And it's basically the form that we've been talking about all along. Sheng Shi Gao. And then the other type they discuss is called calcined gypsum or Duan Shi Gao. This is generally applied externally as a fine powder. Its dispersing property has been removed and is somewhat less cold, but its abilities to restrain and to generate flesh are enhanced. So that's calcined gypsum or Duan Shi Gao. Continuing with calcined gypsum, it is frequently used externally for eczema, scalding, and erupted sores or wounds that fail to heal. However, it is also included in a number of classical formulas for internal use. Harm and benefit in the Materia Medica, the Bensao Hai Li, written in 1893, notes that calcined gypsum is not as harmful to the stomach as the unprepared form, especially if mixed with rock sugar, but it will be ineffective if used in small doses. However, Zhang Shi-chun and others object that once calcined, its ability to vent and release the muscle layer is lost, and if used internally for externally contracted pathogens coupled with heat from excess, it will instead restrain phlegm fire and lead to clumping and other toxic effects. Thus, at present, calcined gypsum is usually applied externally. Chen and Chen have a supplement. There we go. Chen and Chen have a supplement discussing calcined gypsum, Duan Shi Gao, as well. Duan Shi Gao, Gypsum fibrosum preparata. The calcined form of this substance has excellent properties to clear heat, treat necrosis, and generate flesh. It is generally used topically to reduce swelling and bleeding. Duan Shi Gao is generally not used internally because once calcined, it loses a major portion of its effectiveness in clearing heat and sedating fire. Furthermore, Duan Shi Gao has an astringent action and may cause stagnation and stasis in the middle jiao, and thus injure the spleen and stomach. In short, use unprocessed Shi Gao in decoction for oral ingestion and calcined Shi Gao in powder for topical applications. And that's our preparations. Let's talk about Western uses of this herb. After literature search, it seems like gypsum is not a traditional Western herb, though it does have lots of important uses. Very important in construction, it is also important for conditioning soil for several important crops such as corn, cotton, peanuts, and wheat. It's also used as a food additive, as a dietary source of calcium, and in brewing beer and controlling tartness and clarity in wine. Can be used as coloring in drugs and cosmetics, and is the primary ingredient in toothpaste. Chen and Chen say it is antipyretic, immunostimulant, helps healing bones, facilitate the passage of bile, shorten coagulation time, promote diuresis or urination, and reduce spontaneous intake of water or thirst. So that is some of the Western use. Some of those, the Chen are a little bit more pharmacological. Again, it doesn't seem to be a Western herb per se, but it does have lots of uses in Western societies and developed countries. Commentary. Bensky and his team, as usual, has an excellent and extensive commentary on this herb. Acrid, sweet, and very cold, Shi Gao enters the lung and stomach channels. It is very cooling and dispersing. Within its ability to drain fire is a tendency to clear and release. In the exterior, it releases heat from the muscle layer, and in the interior, it clears fire and heat from excess from the qi level of the lungs and stomach. Reducing heat is crucial for the preservation of fluids, and it is no accident that the intense thirst is a signal for the use of Shi Gao, as is the high fever with absence of chills and the large, strong pulse. Other conditions for which this mineral is an excellent choice include lung heat leading to severe cough and wheezing, and stomach fire causing headache, toothache, bleeding gums, or tooth abscess. Used with herbs that cool heat in the blood, Shi Gao can also treat symptoms of heat in the qi and blood, such as rashes, delirium, and muddled consciousness. Commentary on the Divine Husbandman's Classic of Materia Medica. So this is a commentary of the Shenong Ben Sajing, or this is, in Chinese, this is the Shenong Ben Sajing Shu, written in 1625, elaborates. The acrid flavor of Shi Gao can release the muscle layer. Its sweetness can moderate heat. Its great coldness, side by side with these sweet and acrid properties, mean that it can expel intense heat. This herb can disperse pathogenic heat from the yang brightness and direct phlegm heat downward in the greater yang. Thus, it is a major herb in each case. Concern about the powerful clinical effects of Shi Gao has been shared by novice herbal physicians throughout the ages, but more experienced voices counsel that a precise knowledge of one's tools followed by resolute application will achieve better results than a faltering attempt with insufficient but quote-unquote safe doses, which often achieve nothing at all. Essays on medicine esteeming the Chinese and respecting the Western, or the Shi Shui Zhong Zhang San Shi Lu, written between 1918 and 1934, makes this point. There's definitely no reason to think that unprepared Shi Gao, when used to treat externally contracted disorders with heat from excess, will harm people. When used courageously, there's also no reason that it will not reduce heat. The author of that book, Shang Shi Chun, argues that Shi Gao actually does not have the extremely cold properties of Coptis rhizoma huanglian, Philodendron cortex huangbai, Argentiana radix longdan cao, yet its ability to reduce heat surpasses these herbs. He bases his argument on a statement in the Divine Husbandman's Classic of Materia Medica that Shi Gao can be used for postpartum women with externally contracted heat, while the other bitter cold herbs noted here are contraindicated. Shi Gao alone is not forbidden in that context, he points out, and therefore cannot be extremely cold. Shang notes that the cooling action of these bitter cold herbs derives from the cold overcoming heat, whereas Shi Gao reduces heat by driving it out of the body. Shang also suggests that a decoction containing Shi Gao be consumed quite slowly. You want its therapeutic power to remain in the upper and middle burners, and not let the coldness encroach upon the lower burner, causing loose stools or diarrhea. Regarding the question of whether Shi Gao should be decocted prior the other herbs in a decoction, some in China have found that there is an inverse relationship between the solubility of its major constituents and the decocting temperature. There's evidence that only slight simmering at 60 degrees C gives the best result. This is in line with methods described in discussion of cold damage, where none of the 7 formulas containing Shi Gao specify that it be added before the other herbs. So there you go. Interesting. So that's our commentary. Let's talk about comparisons with other herbs. So Bensky et al. Compares this herb with 2 others, Anamorena rhizoma germu. Both medicinals cool the lungs and stomach, and both clear heat from the yang brightness qi level. This pair is therefore appropriate for treating the irritability, thirst, and fever, and the large, strong pulse that characterize this condition. They are often combined in the treatment of lung and stomach heat, leading to such symptoms as thirst or cough. There are, however, significant differences between them. Anamorena rhizoma germu primarily clears heat and moistens, and besides cooling the lungs, also cools the kidneys and nourishes the yin. Owing to its acrid flavor, Shi Gao primarily clears heat and disperses, which extends its effect to the exterior. Its heavy property enables it to reach the interior. Shi Gao protects the fluids by draining fire, while Anamarina rhizoma germu benefits the yin by directly generating fluids. So that's one comparison. The other comparison is with talcum hua shi. While both herbs clear heat and alleviate thirst, talcum hua shi alleviates thirst by harmonizing the spleen and stomach while also leaching out dampness. It is especially appropriate for thirst due to summer heat with dampness and dark urine that passes only with difficulty. It is inappropriate for thirst due to dry heat. Shi Gao alleviates irritability and thirst by clearing intense heat at the yang brightness stage so that fluids can be replenished when the heat has been eliminated. Thus, it is best used when pathogenic heat has entered the yang brightness stage and dried out the fluids, which can only be restored by removing the pathogenic heat. Externally, both substances can be applied topically to dispel dampness and inhibit sores. Talcum hua shi tends to be better for eczema, toxic rashes, and weeping skin conditions with severe itching, while Gypsum fibrosum preparatum, Duan Shi Gao, that's the calcined gypsum, is better for chronic sores which have not healed over. They can also be used together for these purposes. Comparisons. Chen and Chen compares this herb with, we're still on comparisons. Chen and Chen compares this herb with one other, Shi Gao and Han Shui Shi, or mirabilite. Both enter the lung and stomach to clear heat and sedate fire. Shi Gao is more effective to clear heat from Wei defense and Qi energy levels. Han Shui Shi is better to purge excess heat from the Shui or blood level. All right, let's talk about some combinations of this herb with others. So Bensky combines this herb with, and his team combines this herb with 4 others. We'll only discuss 3 as last is the herb of ephedra, Ma Huang. And as we know, Ma Huang is actually not legal in most developed countries, so won't get into Ma Huang today, but we will talk about combinations with other herbs. And we already talked about one of these herbs. Our first one here is with Anamarina rhizoma or germu. Shi Gao is acrid sweet and very cooling. It can vent muscle layer heat and cool stomach fire. While its heaviness directs fire downward, its acrid flavor allows it to reach the exterior. Thus, it addresses both the interior and exterior of the body. Anamarina rhizoma germu is bitter and cold. Its bitterness directs fire downward, while its moistening quality resolves dryness. Together, they have a powerful ability to cool heat in the yang brightness stomach while protecting the stomach fluids that this heat would injure. The associated symptoms are high fever, profuse sweating, insatiable thirst, large and strong pulse, red face, and aversion to heat. At this time, with the pathogenic heat widely spread throughout the body, not concentrated in the intestines, treatment which attempts to clear heat through the intestines will not be effective, nor will the use of bitter cooling herbs such as Coptis rhizoma huanglian or Scutellarius radix huangqin, which will further damage the fluids. The best approach is to use acrid cold flavors combined with bitter cold moistening qualities. Shi Gao and Anamarina rhizoma germu are ideal for this purpose, combining to release heat and eliminate irritability as in white tiger decoction or bai hu tong. So that was our first combination. Our second one is with Lophitheri herba or Danjuye. The sweet, bland, cooling properties of Lophitheri herba Danjuye, which cools the heart and eliminates irritability, combined with the acrid cooling of Shi Gao, provides a rather gentle heat clearing effect. It is much less powerful than the combination of Shi Gao and Anamarina rhizoma germu to clear qi level heat from excess. Thus, the pair would be appropriate for the later stages of warm pathogen diseases when the lingering vestiges of heat still cause insomnia, irritability, and a dry tongue with scanty coating. The 2 herbs can also be used together for mouth ulcers and swollen, painful gums due to heart and stomach heat, or for cough with fever in children. And the last combination that we're going to talk about is with Asari herba or Shi Shin. This is a combination of cooling and warming herbs, so opposites. Asari herba Shi Shin is acrid and dispersing. It opens the orifices and is good for alleviating pain. By itself, it treats only cold disorders, but in combination with Shi Gao, its warming action is moderated, while its rising quality can lift the actions of Shi Gao to clear heat from the head and face. Together, these two substances clear heat and drain fire while expelling wind and stopping pain. The pair is best used for stomach fire blazing upward or wind heat attacking the head, causing headache, toothache, or swelling of the gums. So that was Bensky's combinations. Now we have several combinations that Chen talk about. So generally speaking, postpartum women experience deficiency in cold. However, Shi Gao can still be used if the diagnosis is heat in the qi energy level or in the lung or stomach. Same principle applies to patients recovering from febrile disorders. The key is to combine Shi Gao with tonic herbs such as Renshen radix ginseng or Maimendong radix ophiopagonis, so that heat can be cleared at the same time that the body is being tonified. According to Dr. Zhang Xiaoping, the combination of Shi Gao and Zhimu, radix intramuranea, has excellent influence to lower plasma glucose levels to treat diabetes mellitus. These two herbs are especially effective in individuals with diabetes characterized by qi and yin deficiencies. However, it is important to note that high dosages are sometimes associated with hypoglycemia. Dr. Zhang Xiaoping also states that the combination of Shi Gao and Zhizi, Fructus gardenia, is very effective to sedate liver and heart failure in hyperthyroid patients. That's an interesting use of this. Contents. According to Bensky and his team, the contents of this herb is over 95% calcium sulfate with several trace elements such as sodium, magnesium, silicon, aluminum, iron, copper, manganese, zinc, cobalt, chromium, nickel, and titanium. And Chen adds calcium oxide and sulfite as potential components as well. Let's talk about the science. So Chen discussed several clinical studies and found Shi Gao effective in the following disorders: osteoarthrosis deformans endemica, which is with an N of greater than 600. So that's a pretty well-powered study. Again, all of these have positive results. Acute inflammation and lymphadenitis, cellulitis, or erysipelas. Shi Gao was used topically in 126 patients. So, cellulitis and erysipelas and lymphadenitis, these are all infections. So interesting that these are used in inflammatory infections. Burns used topically in 53 patients. Acute sprains topically in 15 patients. So again, as I continue to discuss, we want to see between 30 and 40 patients minimum before we can start using population statistics. So before they're statistically valid, we need at least 30 to 40 patients. So 15 patients is not statistically valid. Acute sprains topically, that's an interesting one. I wouldn't think of using these in acute sprains topically. There's other things I would use for it. So an interesting use of that. It's used in fever. 200 patients were given Shi Gao, Mahuang herba ephedra, and Guager ramulus cinnamomi for good results. Fever due to common colds or influenza. 15 patients were given Shi Gao and Balangen radix isatis. 15 patients, again, not necessarily statistically valid. And finally, they discuss lobar pneumonia. And they had 9 patients were given Baihutang or white tiger decoction. So again, 9 patients, not statistically valid. Baihutang, white tiger decoction could be very useful in big fevers and infections, but this is a small study. Okay. Let's talk about some drug-herb interactions. Shi Gao is generally regarded as safe, or GRAS is the term GRAS, by the United States Food and Drug Administration, and therefore drug-herb interactions are not anticipated. And a literature search did not find interactions between Shi Gao, and various cytochrome P450 isozymes or P glycoproteins, so none of the things we would normally look at as risk factors for drug-herb interactions. The American Herbal Product Association's Botanical Safety Handbook, which is one of my go-tos on safety on herbs, does not have an entry on this herb. Again, not a common Western herb, though this book is a lot of Chinese herbs as well. Not all, but a lot. There are some concerns, though. So Chen and Chen, no concerns about this herb. Use of Shi Gao is contraindicated in patients who have qi deficiency, yin deficiency, spleen yang deficiency, deficient cold of the stomach, or fever due to yin deficiency. Because Shi Gao is very cold in thermal nature, it is not suitable for long-term use. That's that inferior class that we were talking about earlier with the Shenan Ben Sao Jing. Its use should be terminated as soon as the desired effect is achieved. Again, in Chinese medicine, we don't like having cold herbs long-term because it can damage the stomach and spleen. Bensky and his team note several concerns with Shi Gao as well. Under the heading of cautions and contraindications, they say contraindicated in cases of cold from deficiency of the spleen and stomach, or fever from yin deficiency. Under the heading of traditional contraindications, they quote Harm and Benefit in the Materia Medica, the Ben Sao Hai Li, written in 1893. We already mentioned this book. Fundamentally, it is an important herb for releasing heat from excess, expelling summer heat, alleviating thirst, and eliminating irritability. It readily makes the stomach cold. Warm and febrile disorders generally involve the yang brightness. If there is a headache, generalized aching of the bones, yet no thirst or desire to drink, then the pathogen is in the greater yang and has not transferred to the yang brightness, and Shi Gao should not be used. After 7 or 8 days, when the pathogen has already clumped internally and there's parched stools with alternating chills and fever, this requires purging. Do not use Shi Gao. For summer heat with diarrhea due to dampness and spleen and stomach weakness, do not use it. It should likewise not be used for malaria-like disorders which are not in the yang brightness and do not involve thirst. So basically, we're kind of giving all those warnings that unless there's a lot of excess heat, don't use this herb and cause more damage. Continuing with concerns, Brand and Wiseman warned Shi Gao is contraindicated for spleen stomach vacuity cold and in yin vacuity with internal heat. And as I already mentioned, the American Herbal Products Association's Botanical Safety Handbook does not have an entry on this herb, so I can't talk about any of its concerns. And that is our herb today. Today we started with a discussion of some basic pharmacology and how it may be relevant to herbology. Then we looked at another single Chinese herb, Shi Gao, Gypsum fibrosum, or just Gypsum. This is an interesting, very useful, clear heat and drain fire herb, which we found out is very cooling, that works not by directly cooling, but by dispersing pathogenic heat out of the body. That was the thing that I learned the most about here. As usual, we explored all the intricacies of this herb, as well as an explanation of its category. With that, we conclude another exploration of another amazing Chinese herb. Our next episode, we'll be looking at another herb of the world, saw palmetto, or Serenoa repens. This is a well-known herb used for over 2,000 years and has a modern reputation for treating prostatic hyperplasia or enlarged prostate. As always, we will do our deep dive into this herb and look at its traditional uses and its preparation, interactions, and cautions, and see if the science supports its use for enlarged prostate. And as usual, we'll be adding something a little different. It's going to be another interesting rocket ship into the exciting solar system of herbs. Please join us. And I'd like to say thank you very much for joining us today. If you liked this podcast, please do us a favor, subscribe in your favorite podcast app. Really appreciate it. We thank you for even considering doing that. And you can get this course as well as many others as continuing education units and National Certification Commission of Acupuncture and Oriental Medicine professional development activities at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. And don't forget that 20% off with the code SH20OFF. That's SH as in Spurbs Herbs 20 off. You can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. And as usual, have a good bibliography. And I want to say thank you very much for joining us. All right, everybody, thank you very much. So, Jennifer, what is the podcast? It's Spurbs Herbs. That is the podcast. You can get it in any of your podcast apps. If you have, Google Play, or if you're on Apple Podcasts, I'm on Spotify. There's a bunch of them. So these will be up there. Again, this is episode 87 that we just recorded. It won't be out for a few months still. A few months ahead of things. So there we go. Thank you guys for joining me today. Just want to let you know, next week is going to be an interesting Sunday presentation. We are going to be doing treating COVID and other viral infections with Chinese medicine. And with this COVID course, every time I do it, there's always updates to it. So it's going to be, I'm going to be updating it and putting in a lot of new information. Well, maybe not a lot, but at least some new information on how COVID is being treated today. So that's a good one to always see live. And that's going to be next Sunday from 1 o'clock to 4 o'clock Pacific Standard Time. And then the Sunday after that, I'm going to be doing my course. So in 2 weeks, I'm going to be doing an episode of my Integrative Nutrition series. And we're going to be talking about biochemical supplements in Chinese medicine. So we're going to be talking about some supplements that are just straight biochemistry that are used in the body. But we're also going to be trying to apply that and looking at them from a biomedical point of view. I'm getting more confident. I'm going to be trying to put some Chinese medical spins on some of these supplements that you might see at a Whole Foods or GNC or Sprouts or whatever you get your supplements at. So going to be an interesting one. That's coming up in 2 weeks. So any other questions? Thank you, Jennifer, for your question. Thank you guys for joining us. Appreciate it. We'll be doing another one of these double episodes next month. When will that be? That will be on did I just skip it? Not on the 24th it's going to be, maybe I'm on a different, that's November. Okay, so there we go, October. There we go. October 27th, we're going to be doing it. We're going to be doing another double episode, doing saw palmetto and the Chinese herb Jianghuo. So that'll be an interesting double header. I've been wanting to do saw palmetto for a while, not because it's a common herb, or at least it was a very common herb. There was a time there that every older guy I knew was taking saw palmetto. Now that I'm an older guy, no one's actually mentioning it anymore. So I don't know if it's still used or not. We're going to find out. So there you go. I think that is it for everybody. If there's no questions, I appreciate it. Thank you guys. And I'm going to let you go. Thank you, Vanessa. Appreciate it very much. And glad you can join us. Thank you. And remember, it's free. You guys can join this. It's free, to join us through Net of Knowledge and come and do these. But if you need CEUs, you just pay a small fee and you get the CEU for this as well. So it's free. You can do it. And this is the easiest way to do it. By the way, you get it ahead of everybody else because, like I said, I'm months behind. Not behind, just I'm months ahead of when I actually post these podcasts. And so you coming in and doing this live, you get them before anyone else does. So it works out really well. All right. I'll let you guys go. Thank you very much. I hope to see you again soon. Have a good one. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy Dobbins,
Rogers, Campbell,